Hi, I'm sitting here in my basement having just done a great high intensity interval workout. When a person comes into my clinic, I don't send them to the gym to go exercise with a tech. I don't have them pulling TheraBands. I don't have them work out for 45 minutes and then come and see me like most traditional clinics. So why is that? As you can see, I'm here without makeup. I've got my exercise equipment behind me in my gym in my basement. I believe in exercise. I'm pretty fit. I work out a lot. But when you come to see me for a pain condition, I don't believe that exercise is the answer. What I do believe in is myofascial release and hands-on care. Myofascial release works on connective tissue known as fascia. It binds us head to toe, and it can become tightened and stiff and pull with forces up to 2,000 pounds per square inch, crushing pain-sensitive structures, compressing our nerves, compressing our joints together, causing pain and preventing motion. It can alter our skeletal alignment and make us non-efficient when we're moving, when we're trying to get our activities done. We're not efficient in that skeletal frame. So I believe in treating you with my hands. When you come into my clinic, here's what you get. My physical therapy assessment. You get my heart. You get my hands. I think that's where healing happens. And if you need some exercise, I'll give you some to go home with. We'll give you a few things to do to stay on track so that you continue the process after you've left my clinic. But I believe that true healing occurs when you're with me on the table, focused on your body, improving all of that fascial tension, improving skeletal alignment, allowing for those restricted areas to resolve. So if you've got head pain, jaw pain, neck, anything into your shoulders, arms, all through your back, down your hips, your pelvic region, your feet, come in and try myofascial release. Perhaps we'll use a little dry needling, fine tune a few areas. And if you need some exercise, I'll send you to your own gym, send you home. But you're going to lay on the table and have an amazing session, releasing those restrictions, moving better, and you'll feel great afterwards. Come see me.